Hello, my name is Dr. Matthew Rooney. I'm a consultant anaesthetist and I'm part of the team bringing the shared care record to Birmingham and Solihull. As an anaesthetist, this will be really valuable. For example, I would be able to see the records about your heart from another hospital, and this would enable me to make the right decisions for your anaesthetic so that you receive the best and safest care possible.
As a patient, the clinician needs to know about what medications you're on, any changes in medication you've had, anything you're allergic to. And as a patient, you want them to have this information so they can prescribe you with the right medication or suggest the right management. This shared care record programme helps us achieve this.
What's really great about the shared care record is that it will improve people's experience of the support that they receive, which means that as health and social care professionals, we can work together more closely. As social workers will already have the key basic information, which they'll view through the shared care record. That means that the person won't have to repeat their story and will be able to focus on the main points that they want to discuss with us. Other professionals, like GPs, will also be able to see details of the person's social care support, which will enable them to have a better understanding of the person's situation and needs.
Social care is a very important part of the health and social care system. The two operate very closely together. For example, a lot of patients discharged from general hospitals go to social care settings like care homes and so on. And for a very long time we've struggled with this disconnection between the two.
Many of the patients that I look after can be old and frail. They sometimes have to go to hospital appointments on their own because family members or carers aren't available to go along with them. At these appointments they may be asked lots of questions about what medications they're on, what's happened recently, when did a certain procedure happen. A lot of information to share across with the people trying to look after them. So therefore, in this instance, the shared care record programme is even more important.
Lots of the patients we see in paediatric intensive care have had very complex care journeys and been seen in multiple different centres. They're also cared for a lot of the time in community settings and by their general practitioners. At the moment, we're expecting parents and carers to remember all the information of the children's journey, and this can often be very difficult, especially when they're acutely unwell. So this would enable us to see the whole patient journey, to see the care and treatments they've had in multiple centres. And overall, I think this would make for a more seamless journey and a safer journey for those children.
In an emergency setting, we have patients that need immediate treatment, and all the information gathering is time critical. To have up-to-date records available, such as the drugs that they're taking, the doses and any vital allergies, will prevent patient harm and can also prevent delays which can be life-threatening.
So if we take an example of a man with schizophrenia who also has severe diabetes, he's admitted as an emergency to the QE hospital. The hospital are able to look on the shared care record and they find out from this a list of his current medication, which the Mental Health Trust is providing, also some recent blood tests that the Mental Health Trust carried out. And by looking at both those two pieces of information, they're able to identify that the cause of the problem is an interaction between some of the medication for his mental illness and some other medication prescribed by his GP. And then putting all that information together, they're able to very quickly formulate a plan of treatment which leads to an improvement in his care, and he's able to be discharged from hospital. As the preparations are made for discharge, the social care services are able to be involved. So just having a small amount of information available to all these people allows the care given to this individual to be joined up and to minimise the duplication of repeating things and to allow everyone to work together to give the best possible outcome.